This is before or after?
Okay, perfect.
And you can use this as well.
Yeah. Just before starting, I would like to make an appeal, let's say, because I'd say this morning, so I arrived yesterday from Beirut, and so my presentation is about Sierra Leone, but I kind of missed this opportunity to mention that where the wars that are ongoing in Gaza and Lebanon, we will be bombed by a terrorist state. There's no respect for human life. And from the last 17th of September, the day of the so-called pager attack, the overall number of victims in both countries have reached more than 42,000. This morning for Lebanon was 1,774 victims. So I would say this madness must stop. It is bringing more suffering, more hatred, and more wars. Given the inertia of the Western world, I believe this conference could be a relevant stage to send an appeal to the countries from the global south to come together and stop this bloodshed. Okay, thank you. Now, going to my actual research, it's called Free Maternal Care when the nurses are unpaid. Pregnant women navigating the Sierra Leone faltering free healthcare system. It's a study conducted together with my supervisor, Dr. Peterse. Although it's separate, it is made into sections. Mine tackles the problems from the community perspective, while a study investigates the health services and healthcare providers. Question. How do you know, some of you, not Ellen of course, the number of maternal death per 100,000 live births in Sierra Leone? Give me a number randomly. No. No. Just, okay, it's 717 per 100,000 live births. This means that in a year you have about 15,000 maternal deaths in Sierra Leone. To make a comparison with Ireland, in the last 20 years, the maternal death average was like 5 per 100,000. So every maternal death in Ireland, you have 280 in Sierra Leone, which is quite high number. Where do I click? I like this, okay. As you can see, this is just to show where the research is taking place. It's a cross-sectional case study. These are initial findings from one location, Port Loco. I'm still working on the data analysis from Freetown, Western area, and Bo. And so this presentation is uncovering findings about 22 interviewees. The total will be 66 at the end. The unit of analysis are the pregnant and lactating women over 18 years old of age, but also fathers, because husbands, sorry, because also husbands have a important role in the topic, particularly as usually those who pay for the cost that we will see later. As an outcome, we hope we can promote some advocacy with stakeholders that we are already engaging with. I took an engaged approach in different stages of the project, because we believe that having the participation of not just the community individuals, but also all actors working in health in the country will be fundamental to see if something is possible to be done. So, for instance, I had a pilot visit with 6 focus group discussion with women, pregnant and lactating women it was March, I don't remember the date now. Yeah, no, it's written there, March 2023. I used it also, it was useful to come up with my interview guide that was then used during the actual interviews. I want to point out also that AC, which is advisory committees, which are these groups of women I met in March, and stakeholders, which are yes, community participants, but also health authorities, NGOs, all actors, donors, all actors working in the health sector. We had the first meeting in February 24, where we presented these and other findings from my colleague to show them there are some elements that we discuss later that would be important to look into together. So why this is related to the fact the research question is it does the presence of unsalaried health worker have an impact on the health outcomes of pregnant lactating women and on this high number of maternal deaths we have in the country. We have disclosed by the Ministry of Health itself in 2016, we have 50% of the health staff in the country that is unpaid. Health staff, which includes laboratory technicians and other cadres. But anyway, of these 50%, 40% are nurses. So unsalaried health nurses, sorry, I missed something. Okay, sorry. Unsalaried worker, so may have an impact or not, we don't know yet. However, first findings, we have seen that main barriers for the patients in accessing healthcare services are informal charges for care and medication, due also to the faltering system, because the procurement system in Sierra Leone of medication is not constant and efficient. The nurses have come up as an important element for the patients, which has two sides. They are seen as positively in the sense that they're appreciated for their skills and competence, and also they can provide some kind of drugs, but the informal charges discourage attendance, which can delay then the seeking care. Then there is a positive note in the sense of reliability and availability of the healthcare system. Interviewees disclose that they prefer biomedical care now compared to other traditions and ways they used to deal with their healthcare before. So if you look at these three main areas one by one, so cost is a problem, cost of care. The HCI, which is the Free Healthcare Initiative, was started in 2010 to allow pregnant lactating women and children under 5 to have access to free healthcare, is not working anymore, or at least it's partially working, let's say. Families are obliged to take loans from family members or neighbors, so this put them in risk of sometimes of catastrophic expenditures, highly heavy indebtedness. As I said, the drug supply is unreliable and unpredictable, so the option is to buy the medication from the nurses. How? Nurses go to pharmacies outside, buy the medication, resell them in the clinics. So these costs, which are always unpredictable, can delay the healthcare seeking behavior. These can bring potential negative outcomes. You can have unsafe, you can have miscarriages, maternal near death, misses, maternal deaths, and so on. I mentioned, so the nurses plenty of times. So do the unsalaried health workers impact? Well, yes and no, in the sense that, as a key informant told me, paid or unpaid, they all have the same behavior, in the sense they all charge for informal fees, because most of the salary staff also receive very little wages, and the cost of life is heavy inflation. It's happening everywhere in the world, and Sierra Leone too. So it's difficult for them to survive. There is a problem with absenteeism because, again, either they are unsalaried or salaried with minimal wages. Many have double jobs, so this brings absenteeism from the work. Mostly you have the full staff in a clinic during clinical days when they have all the ANC visits or postnatal care visits. But in all of this, I'm asking myself is if it's right to blame the nurses for these absences, physical or for their charging of fees, because in the end they are the last link in a long chain of dysfunctions, and at least they are able to cope in a way that they can bring medications, although patients end up to pay for them, of course, because they have to cover for their expenses, but at least we have medication in the clinic. So it's a bit of philosophical problem, if you want. So in the end, the last sentence says the patients are resigned to pay for these fees, and sometimes they just need to delay their visits and wait and see. So the last point was the realization that there is overall an increased reliance on the healthcare providers. As you can see from the graphic, in the last 10-11 years, home deliveries have reduced enormously, and at the same time, facility deliveries have grown a lot. This means that there is trust towards the biomedical healthcare system. There is trust on the nurses' competencies, even though, as Helen this morning was showing, that most of health staff is not skilled staff. So, but still, there is more reliance in the medicalized approach, let's say, compared to traditional ways. Although, as you can see from the picture, I found that many people still use some herbs or powders to cure, but it's more for secondary problems like skin rashes, things like that. So it seems that the interviewees understand the importance of seeking care from skilled healthcare staff, and notwithstanding the cost, they report anyway they trust their nurses, the health staff. Maybe what can be missing in this relationship between the patient and the health worker is the third party. The health worker in the end represents the healthcare system. So maybe some kind of third party like community committees or a figure that could try to intermediate and grasp also the needs and demands for, because even I have the feeling that from my interviews in Sierra Leone that the health system gives for granted that the patients would get would be happy to receive whatever they give, but it's not exactly what is needed. So, in conclusion, the fair care initiative is no longer applicable. We raised this issue during our meeting with the stakeholders in February. Someone was surprised because they have a different feeling, but when the patients go to the clinic and receive, for instance, for a malaria treatment, they have to receive 5-6 pills, and then they are given one only because the nurse needs to leave other aside for potential new patient, and then if the person have to go and buy the rest of the treatment at the pharmacy, there is something that doesn't really work. So maybe there will be there must be some kind of reform, or at least have some kind of price list fixed that where the patients could know in advance how much they may need to pay when they go to a clinic for a specific treatment or service, whatever. At least they could come prepared, because another issue, which is not always in West Cork, but in West Ireland, is also in Sierra Leone. The transportation distances, it's an heavy cost. There are no many services except of the motorbikes, and so when someone has to pay motorbike to go to a clinic, then is told that he has to pay more money for. Then it is, you don't have that money. You have to go back home. So better to know before the price, so you can inquire at least with your neighbors, lose less time, and because time it's important in terms of safety, because if you are talking about a delivery that some person then maybe to be referred to a hospital, there is the risk of stillbirth, the risk of maternal deaths, and etc. So we are trying, hopefully, to advocate for some reform about this, for the potentially have more involvement from the communities about their own position about access to healthcare services. And the on-site health staff, of course, should be registered to the payroll with a clear time frame, a minimum salary, but something that then would, it requires a clear budget every year. Someone yesterday was saying, yeah, money is always important, but the people are more important. Yeah, it depends on the context, because in this case, I would say the money is not a secondary, unfortunately, element. So also, I wanted to add the line, I forgot. That's why we discuss a lot with the stakeholders like donors, because they are those who also fund for the free healthcare initiative, and there needs to be their clear involvement in order to improve on this element. Thank you.